I was accused of marketing homeopathic remedies in my private clinic. And I just want to make clear, I never marketed any homeopathic remedies, especially the survival data cannot be cheated. I'm not a believer. I don't believe in homeopathy. I don't believe in medicine. You have to prove it works or it does not work.
Professor Frass, it's a pleasure to have you here on Homeo Sapiens again, as usually, and it is always nice to talk to you. We had a couple of videos already recorded, and one of them was about your study on advanced cancer patients. You perform at Medi University Vienna. This study, as we know, was published in 2020, and recently there were some developments after we decided to meet again and discuss the study again.
Thank you so much. This paper was about our investigation concerning patients with advanced stages of lung cancer. And the interesting results were that not only quality of life, but also survival was improved in the group of additionally treated patients with homeopathy. And this was a double-blind, prospective, randomized study. And therefore, the results are very interesting for not only for the homeopathic community, but as you could see, also for the conventional medical world.
We already talked about the study on Homeo Sapiens YouTube platform, and I didn't expect we will come back to this topic soon. But we decided to have another interview because of the recent developments about your famous study.
You mean you would like to talk about the retraction?
I wouldn't say I would like to talk about retraction because it is not nice to have the paper retracted, as I can guess. But something happened.
You know, already 1 year after publication, there were severe accusations that we have falsified or we had made data manipulation, things like this. And those were generated by an engineer, by a German engineer. And then the commission of the Austrian Agency for Scientific Integrity, they did assessment and finally published a final statement. And this was telling us that our study was inferior, manipulation, falsification, lying, everything like this. And then it was quiet for about 2 years. And on October 2024, the journal, it's a conventional journal, The Oncologist, it stated that our data are valid. And we were very happy. I could announce this because this was just before the Liga conference in Sevilla. And to my surprise, last summer, just by chance, I found a small email accusing us that we did not mention how these homeopathic medicinal products are working. Second, I was asked how many patients I have transferred from the single-arm study to the double-blind two-arm study. So I was very surprised because I've never done any single-arm study. So it was just like a joke, I would say. And the third thing was whether or not I'm using the same remedies in my private clinic. And it was an ultimatum. It said, I have to answer within 3 days. Okay, I did it within 2 days. And it was confirmed that my email has arrived. There was no reactions except for this confirmation. And about 3 months later, I received the final decision. Now we have to retract this paper because it is not reproducible because the homeopathic medicinal products were prescribed individually. I was accused of marketing homeopathic remedies in my private clinic. And I just want to make clear, I never marketed any homeopathic remedies. So it's another joke, especially the survival data cannot be cheated because there's a special randomization program and it writes a protocol, a so-called audit trail, all the time. And I cannot influence this. So if I include a patient or if I exclude a patient, it's always written down.
I would be interested to have a statistic. Average survival in homeopathic group was 6 months more than in the placebo group. Okay, but what was the survival of phosphorus patients against arsenicum patients or against the placebo group? Since we are doing the study and since we have statistics, maybe it would be worth to do somehow internal validation of the procedures. I think this would be worth investigating because we really don't know. Maybe in some specific clinical conditions, we should pay more attention to the disease than the patient himself.
Absolutely correct. As you know, I'm just recently participating in the Delphi study regarding homeopathic method for side effects of conventional medicine, which is performed by Jean-Lionel Bagon from Strasbourg. And so he asked in this Delphi study, which remedy, for example, you are using first to counteract or to prevent side effects of chemotherapy. I was influenced by Dr. Spineda and Dr. Wurster from Switzerland, where because these Q potencies, they put a little bit different influence on the body every day. So it is a little bit different. It's not always exactly the same load or effect. I use mainly constitutional remedy or a tumor-specific remedy. And in addition, I'm using remedies to counteract side effects of chemotherapy, mostly Nux vomica, to be honest, maybe aided by Okubaca. And if there's radiation therapy, I like to prescribe cadmium sulfuricum together or solely with radium bromatum. And if there's some surgery, I prescribe in any case Anika. And I also like to prescribe in advance gelsemium because of course patients are afraid before surgery is performed. And just as I would say an umbrella which helps against rain, you can take lachesis. I use LM6. If post-surgically an infection would happen, and I recommend to take phosphorus C200 with you if there's some unintended bleeding.
So the study was retracted, but results are still valid.
If you look to the Anika study of Paolo Bellavite, you can still read it. It just says it's retracted on each page, but you can still cite it. You can cite it if you like. I am also more or less sure that a study of Emma Cortes from Mexico regarding comparison of homeopathy versus conventional medicine in postmenopausal women with middle or severe depression. I think you can still read it in PLOS ONE. And also, this study was also redacted after years. I think it was also 5 years or something like this. So it's also a joke. I think for me, it's not, these retractions are more jokes. You cannot take them earnest because it's, I'm a scientist and I'm not a believer. I don't believe in homeopathy. I don't believe in medicine. You have to prove it works or it does not work. So it's, for me, all these suggestion, there could be, it might be, or whatever. This has nothing to do with science.